Hi, my name is Jennifer, and I will be presenting a patient case to my preceptor. Melissa is a 33-year-old woman with complaints of vaginal itching and thick white discharge. Her symptoms began about 3 days ago, and she denies the presence of burning, odor, or pelvic pain. She states she had a recent UTI treated with macrobid. She's currently in a monogamous sexual relationship with her husband, and today her vital signs are within normal limits. On exam, she did have erythema of her external genitalia and the presence of curdy white discharge, but no odor. So to narrow down some potential diagnoses for this patient, I want to consider vaginal candidiasis and bacterial vaginosis. I'm leaning towards vaginal candidiasis given her report of the thick white discharge and seeing it on exam. It looked curdy. There's erythema of her genitalia and a lot of itching, plus she had recent antibiotic use, which predisposes her to a yeast infection. I could consider bacterial vaginosis because it is a very common cause of vaginitis, and the discharge is white, but the discharge doesn't have an odor. It doesn't have a positive whiff test, and her symptoms are just not consistent with that of bacterial vaginosis. To probe my preceptor, I would want to know what other findings that she has seen in practice that could also help differentiate between a diagnosis of BV versus Candida. So my plan for this patient would be to, I could have obtained a sample to look under the microscope, and that could still be part of the plan. And just see if there was hyphae or pseudo-hyphae with the KOH, which would indicate more likely that it is a yeast infection. But based off of the subjective and objective portions, I want to prescribe her an antifungal. So I would choose turconazole 0.8% cream, 5 grams intravaginally that she can use every night for 3 days. And then I would want to follow up with her in about 3 to 5 days just to reassess her response to treatment. So for some self-directed learning, I want to look more into evidence that could potentially suggest that using probiotics with antibiotics may help prevent yeast infections. And if that is the case, and there's a lot of research and evidence pointing to that, to kind of use that in my future practice when I prescribe antibiotics.